All right, so the first thing we want to do with this little angel is pick him up and we're going to look at the head. We're going to feel the anterior fontanelle. It should be soft and flat. Sometimes when they're crying it might be a little bit bulging. You're going to feel the suture line. It might be a little bit open, might be a little overlapping, but it should be well approximated lining up. You'll follow that back. You're going to feel the posterior fontanelle. It should be a lot smaller than the anterior fontanelle since it closes after the anterior fontanelle. I'm going to look over at each ear. Because for each ear I want to make sure that the pinna, the tragus, that there isn't any pitting. Looking over on the other ear. Also when you're looking at the head, you might see some molding, some coning of the head. You might see if they had a forceps delivery, some abrasions, a cephalohematoma, if they had a vacuum. I'm looking for any swelling, capita of the skull. Then I'm going to take my fingers down, follow down around the neck. Slowly feel each clavicle. You want to make sure it's nice and smooth, that you don't feel any fractures. It's okay. It's all right. I'm going to make sure that there's no crepitus. Crepitus will feel like little bubbles under the skin. Then you're going to look at the eyes. If the baby's awake and staring at you, that's great. But you're going to make sure that there's no swelling. You're going to make sure that there's no swelling of the eye. And look at the conjunctiva. It should be nice and pink when you hold it down. The sclera shouldn't be injected. It should be white. You might see some milia on the nose, completely normal. You might see some newborn acne, some red spots on the face. That's completely normal as well. So then I'm going to go and take the shirt off of the baby because the biggest thing is that you want to see a full skin exam. So this baby you can see has some newborn acne, erythema toxicum, completely normal as well. Okay. Oh. So I can see the baby when he's crying, that his tongue, that his tongue's going up, and that's a good sign. It shows that he does not have a tight frenulum or that he's tongue-tied. You always want to take your finger and put it on the roof of the mouth. First off, you're seeing that the child has a sucking reflex, but also you're seeing that the palate's intact and that it's not a high palate. You could put your finger along the cheek and you could see if the baby has a rooting reflex, which is a normal newborn reflex. So it's nice to use a gloved finger to be able to have the baby suck so you can hear the heart sounds better. So we use the mnemonic 8 to man, aortic, pulmonic, Erb's point, and the mitral. So you should hear an S1, S2. If you hear a swooshing sound, then you're concerned that it could possibly be a murmur. After I listen to all 4 areas on the heart, and you want to make sure that you listen to all 4, because if you only listen to one, you might miss a murmur. You're going to listen to the breath sounds. So you want to listen in the front and the back. With a baby, you're fortunate enough that you only need to listen to 4 areas on the front. I go down and listen to the vowel sounds. You should hear gurgling. I'll do it this way, so you could say, it's okay, it's okay. Hold them on the side. Listen to the 4 areas on the back. Okay when you listen to the lungs because you actually can hear even better if they're nice and clear. And you want to make sure that you listen to all of these areas even though that it's not a large surface area because you don't want to miss anything on a little baby. Okay, so he might start crying again, but now I'm going to go down, look at his arms, checking range of motion. Good. checking his tone when I'm pulling his hands down. I can see his grasp reflex of his hands. I'm pulling up to see some head support. You could also check the startle reflex to see how he does. Then I'm looking at the abdomen. I'm looking at the skin color. I'm looking at the cord, making sure that there's no drainage, noticing if it's clamped. You could see the abdomen, completely normal, might be protruding a little bit. The abdominal muscles aren't as strong yet. Okay. I like to take the feet and kind of hold them up to relax the abdomen so that muscles aren't as strong or as tight. So then don't be scared to really feel because you don't want to miss if there's any masses. Then I go ahead and check the liver. It's not palpable in this baby. So when you're listening to bowel sounds, you always want to make sure that you listen before you palpate the abdomen because it'll distort any bowel sounds. Also, if you notice a bruit or anything like that, you don't want to rupture it. Alright, so now I'm going to go down. As nurses, you're not going to check the hips of the baby per se like we will, but when you're changing diapers, you're going to notice range of motion, moving their legs around. You'll notice the tone. If there is any click that you do notice, just with normal diaper changes, you want to make sure that you let the provider know. You're going to look at the feet, just as with the hands. You're going to count that there's 5 fingers. You're going to look at the creases on the hands, creases on the feet. They have a nice little grasp reflex on the feet. You're also going to check a Babinski, which you can see the toes are fanning out, which is normal in newborns. So you'll go into the genital area. You're going to take your fingers down and you're going to, oh, I don't know if I checked the pulses up here, but just in case, checking the pulses, brachial. Then I'm going to go down, check the pulses, femoral. You're going to work from top to bottom because obviously once your hands are dirty, the diaper area, you're not going to go back up. So I'm checking the pulses. Good. And I'm looking at the circumcision. If it's a boy, everything looks great. So you're going to palpate, make sure there's 2 testicles. 1, 2. And then you also want to look at the bottom. You want to make sure that they have an anus, and you want to make sure that there's not any tuft of hair or sacral dimple on the baby. Next, I'm going to lift up the baby because I want to check the back and check the skin. So I'm looking at the skull again, looking at the head support. I'm looking at the spine, making sure it's nice and straight. Excellent, good job, love. Then I'm going to check the stepping reflex. Good job. It's a lot harder to have him do it with all the bands and everything on their body. So if this was a female, when you're checking the genitals, you'll check to see, make sure that they labia, that there's some separation of the labia. The labia might have a little bit of edema, and that's completely normal, but it's something that you'll want to document. You might also notice that there's some mucus in the labia, some vernix there, all completely normal. And the overall, you're listening to the baby's cry, you're looking at the baby's facial expressions, making sure that it's not grimacing, consolable whenever you're holding the baby, that finger to be soothing. So that's it on our newborn exam.